Should we hit the lights or?
We're good.
Okay. So today.
Yeah, dim them a little. Dim
Oh.
the lights a little bit.
I will try
very
to
good.
go fast, guys. I promise. So today I'm going to be presenting my project working on the regional Western New York Community Health Assessment document. I'm going to start with some background, then get into the slides about the overall picture of the region, and then finish up with recommendations.
Do you want me to flip for you?
Oh, no, it's
You
fine.
should. Okay.
So background to my involvement. As part of the MPH program offered at the University of Buffalo, all students are required to complete a field training experience. And the field training experience allows these students to gain experience in public health, practice the concepts that we're learning in the classroom, develop leadership skills needed to become professionals in public health. And it also allows us to make contacts with professionals already working in the field of public health. So the regular meetings that were assembled by the Western New York Public Health Alliance to work on the community health assessment documents allowed for the different health department personnel to come together and work on their county CHA documents. And these meetings were a unique opportunity to share ideas for the community health assessment process. So background to my involvement, I became involved in 2009 by meeting with members of local health departments. The initial goal, which I signed up for, was just to help collect the data for the community health assessment.
I've reminded her of this a few times.
That was your first mistake.
Yeah.
So all the data was already available to the New York State Department of Health website in their statistics and data section. So I assisted by getting specific data requests and sending out data for those information, for those health indicators. And I also assisted by sending out information, just general data which I thought the counties would find useful in the CHA process. So working with the members of local health departments really gave me an opportunity to learn about public health while being in a position to help out with the CHA process in a meaningful way. So this was a true win-win situation. As a student, I also had the opportunity to tour various health departments. This was a great opportunity for me to meet with members of local health departments and hear about their experiences. Visiting the health departments allowed me to observe all the different roles within each department and see how each role helps to shape the health of their community. Visiting local health departments is a truly wonderful opportunity for students. It allows for a greater understanding of the public health role. We read about it in books, but going there and seeing the people and hearing about the experience really brings it to life. And talking to health department personnel about their experiences, I had the opportunity to hear about some of the unique challenges they had to face. For example, the October storm.
4 years ago, the day before yesterday.
Yeah. So after the individual county health assessments were completed, there was a desire to get an overall regional picture of the 8-county area. The biggest challenge with this was to somehow gather all the information presented in these 8 separate documents and merge it into one overall regional document. So there were some challenges with this. For example, some of the counties are predominantly rural, while others have large centers of population, such as Niagara and Erie. There were also unique challenges in terms of differences in such as resources, access to care issues, healthcare availability, socioeconomic issues. Another reason was that the community health assessment documents themselves had various differences, making it difficult sometimes to compare across 8 separate regions. So this is an interesting slide. This shows you the length of the document. Now they're all required to contain certain information, but this just shows you the range of variability. I mean, they start anywhere from 55 pages all the way to 325 pages. So there's a lot of variances among these 8 documents.
And it's interesting, not necessarily related to the complexity or the populousness of the area.
Yes.
So Anwar was working with 1,249 pages of material.
Can I take questions at the end? Because I do have a lot of slides.
Just hold on.
It's a planned.
So these are the requirements for the community health assessments required by the state. There were 5 sections. Section 1 was populations at risk. So this section talked about the demographics and basic service areas. Section 2 was local health unit capacity profile, talking about the organizing, the staffing, and the technical abilities of individual health departments. Section 3 was problems and issues in the community, so community resources, assessment of the services being offered, any collaborative efforts that were going on. Section 4 was local health priorities, and this time the hospitals were also involved in selecting these priorities because of their community service plans. Section 5, opportunities for action. These were opportunities for collaboration with other agencies and groups in the community. And I found it interesting that for the opportunities for action, the local health departments were not required to act on whatever they listed. This was more if the reader went back and someone in the community read this. This was more for other organizations to have a way to get involved to impact the health of their community. So working on the regional picture. So it was important to come up with a method to systematically select out information from the 8 individual documents. And due to the large amount of information presented, along with the various differences, this proved to be a challenging task. So to objectively select out data, I developed a set of spreadsheets. And the spreadsheets allowed basic information on demographics and some of the health issues in each county to be collected. The local health priorities, section 4 of the CHA, those were also mentioned by each county, and those were noted. And having these spreadsheets allowed a systematic way to collect data across all 8 counties.
This was very, very difficult to do.
I can't
So
imagine.
this is just a snapshot of the spreadsheet. This is just an example of what it looked like. So it just had some basic information along with just if they give prevalence and basic information like that, along with their priorities. But this really allowed me to go and look at these 8 separate documents and pull out common information. Because just looking at the page numbers, you get an idea that there's a lot of variability among the 8 documents. So this is a slide showing the basic population of Western New York recorded in the individual CHAs. So you can see the population reported by each county, giving the total population of Western New York at 1,545,860. So demographics in terms of ethnicity, all 8 counties are predominantly Caucasian. The second most common ethnicity is African American. So this is the slide showing the percentages for ethnicity. And once again, we start to see a little bit of the variability. For example, Cattaraugus County, they didn't list it as percentages. Now they give the total population, so it's very easy to figure out the percentages. But I just wanted to leave that on so you get an idea of when you're comparing across 8 different counties, just small variations, they start to add up. So this is looking at income levels by each county. I recorded median household income, which what most counties used, but there were also differences. Some counties were reporting median non-family household income, mean family income, per capita income. Some included all of them. So once again, we start to run into this problem of the little variabilities. But I tried my best to get the median household income per county. Living in poverty, this is a very important slide because it's very hard to have good health outcomes, if you're at risk, if you're low socioeconomic status and worried about putting food on the table, just basic issues. And this was kind of shocking to me. I didn't realize the poverty rates for the Western New York region were this high. Once again, we start to see counties reporting it slightly differently. You see percentage of residents, percentage of households, percentage of families. And looking at Orleans County, we can see that the percentage of families and percent of individuals, it starts to make a difference in how you're reporting it. But this was